Hello, I'm Carol Reed. I'm a member of the Needham Coalition for Suicide Prevention. And we're happy today to welcome Dr. Kevin Hill from McLean Hospital to talk to us today about substance abuse and related mental health issues that are indicated in suicide and suicidal ideation. Dr. Hill, thank you for coming.
Thanks for having me.
And could you take a minute to share with us a little bit about the work you do at McLean?
Sure. So I'm one of the addiction psychiatrists at McLean, so I do clinical work there and also research. So clinically, we have a variety of programs where people come in and receive treatment for a variety of substance abuse issues. I would say probably 40% alcohol related, 40% opiate related, and 20% everything else. So in addition to that clinical work, I also do research related to developing treatments for some of these substance use disorders. In particular, I have a grant that is looking at developing treatments for marijuana dependence. So we're running some clinical trials now developing treatments for marijuana dependence, and as it stands right now, there are no FDA-approved medications for cannabis, and we're trying to develop some right now.
Extensive work, and we are fortunate to have you here because as our coalition works to educate the community, we understand this significant correlation between substance abuse and the risk of suicide. And our goal today is to have you share some of the information that a community can take in to enhance their protective factors. And I know that the research that we've read recently indicates that 60 to 90% of people who have attempted or taken their life by suicide have a mental health or substance abuse disorder. Can you share any background and elaborate on that for us?
Sure. So that means there are a lot of factors that play into somebody actually completing a suicide. And so to me, those statistics underscore the hope that is available, the reasons why people like you and I should try to educate the people of Needham as to what types of things they should be looking for in people that are suffering from mental illness or issues like depression or substance use. And so if you're able to perhaps identify people that are having these kind of problems, you can intervene, and there are treatments available that actually work. And so if you can get in there before things get out of hand, perhaps we can prevent some of these acts from happening.
Mm-hmm. I know that substance abuse and depression and anxiety are treatable disorders with medication and behavioral therapy, most often a combination of both. Can you share with us what type of signs people should look for with friends and family that would motivate them to reach out for treatment, and perhaps also elaborate a little on the stigma that holds people back from addressing mental health and substance abuse issues?
So the stigma is very prominent, and we'll get to that. But I think in a situation like this, it's important to think about the most common things that people can look for. And so I think when you think about people that are contemplating suicide or actually attempt suicide, I think depression and substance abuse are two things that often play a role in these kind of situations. And so in terms of depression, there are certain signs and symptoms that we can look for. It's the depressed mood, obviously, is the first one and most prominent one. Somebody's just not acting themselves. They seem to be sad or blue on more days than not. A difference in sleep. Is somebody sleeping more? Are they sleeping less than usual? Interest in terms of, are they still doing the things that they like to do? Energy is another instance. Is somebody, they may not be sleeping well, but they're in the bedroom all the time. Again, they're not getting to school like they should be. They're not participating in the things that they normally do on a daily basis. I would say appetite is another thing. Somebody dropping weight is a sign that we often worry about. Concentration. So again, you may see that in terms of somebody not performing in school or at work as they might normally. Something that we call psychomotor retardation, which means that just somebody who is they just seem to be in slow motion all the time. They're just not themselves in many ways. And then suicidal ideation. I think it's important to talk about the fact that if you talk to somebody about how they're doing, a lot of times people will say that they have thought about doing something, or just thinking about maybe not wanting to be around as much. Somebody can actively think about suicide and think about having a plan of what they might do, but they also may be a little more passive and say, yeah, you know what, it may not be a bad thing if I didn't wake up tomorrow. And those are obviously red flags. And those are situations where if you can identify somebody that's having some constellation of these symptoms, they'd be somebody that you want to try to make a referral for, or try to coax into seeing a counselor, a psychiatrist, or a nurse, or whatever. I mean, just to try to get somebody into treatment is a very important thing.
If you had 2 or 3 things to share with families, or how to intervene with a substance abuse issue that they could help their loved one, what could that be?
You have to be vigilant about trying to communicate. I know it's difficult, with kids of all ages, really. A lot of times they don't want to tell you about what's going on, but you have to try to stay on top of it and communicate in a meaningful way. We're not talking about texting. So you need to know sort of where they are, what they're doing, how they're feeling, and try to help them understand that despite the fact that you may want them to do things a little differently, and they certainly pick up on that, as long as they understand that by your interest, that you really care about what's going on, eventually they can come around and feel comfortable in talking with you and when something's not going right. So you're asking them about how they're doing, you're looking for signs that something might not be going right. And if you are able to have them tell you something's not right, or if you pick up on that, there is treatment available, and treatment that works. And it's not easy, obviously. When you get into treatment for these kind of issues, a lot of times we'll have families pull a kid in to treatment. And so then we do what's called readiness work a lot of times, where we just, in a non-judgmental way, lay out the pros and cons of use. One of the important things that I like to talk about when I'm working with somebody, are what are the things that they think they get out of using. They're positives to it, right? I mean, people who go out and drink, it feels good in the short term, obviously. It creates certain risks, but there are reasons why they engage in these behaviors. And so I want to talk about that. And when we talk about giving those kind of behaviors up, I think you have to talk about what it's like not to be able to do something that you enjoyed to do. So we're talking about grief in many ways. So I think when you lay these sort of things out with people, whether it be kids or adults, eventually they realize, you know what, I do like to drink every weekend, and I probably drink too much on the weekend, and I probably could be doing better at work. Eventually they kind of come around, and if you sit with them for a few sessions, a lot of times they'll eventually become open to your recommendations about what kind of treatment they want. If your child or somebody in your family isn't doing very well, there's a strong reason, there's reason to be hopeful about it. If you can just identify the problem and try to coax them into getting some treatment. Get help. Don't worry alone. That's something that I've been taught throughout my training. Don't worry alone. There are a lot of people out there that want to help you. And so, that's why a situation like this is so worthwhile, because we help to show people that, there are people out there that want to help you.
Yes. Pick
up the phone and then, let us kind of do what we do.
Right. There is a lot of hope, and I like the fact that you said you don't have to do this alone. I thank you for being here. You are very kind to spend time here in Needham and share your expertise, and we're grateful that you can reinforce the fact that, like any chronic illness, it's a long road, but it's absolutely real that help and change is a part of this. So thank you, Dr. Hill.
Yeah, great. Thanks for having me.
My pleasure. Thank you.